So I'll give just a quick little background of mine just to keep us on track. I am an OBGYN, so I'm one of those horrendous doctor types. And that's just kind of by way of context how I enter into, and it'll be kind of obvious in some of my comments, that I have come through that training, which I think is valuable because I think it teaches us some of how skewed, I think physicians are the most skewed in our kind of biomedical approach, and we're trained, we don't go into the system that way, but we quickly become trained to find disease, diagnose disease, treat disease, cure it when we can, and manage it when we can't, and that's our scope. And there's been a lot of conversation today. I would say one of the things that I've observed today is that I think the real opportunity for transformation of healthcare in this country will be not doing consumer initiatives over here and medicine over there, but really looking at the whole. Oh, good, cool, thank you. Oh, great, thank you. I can do it without it, but so as you can tell by what I titled this, I mean, I won't go into. I don't have enough time, and you all are probably already converted to know we are truly at. I think a critical moment in the history of medicine like we've never been before for a whole lot of factors we could spend a bunch more time talking about. Should I advance that myself? Yes. I wanted to give you some perspective. I should also tell you I am new to the VA. I've never worked in the government in my life. I've been in academia my whole life until January. So I'm not the expert on the VA, but I will tell you that I left Duke to join the VA when I learned not only of the amazing work happening there, but the huge commitment to major transformation in the largest healthcare system in the country. And I think the VA is positioned to do something and model it because of the size of the system it is, because it has one database, because of a lot of reasons. We have an opportunity to model things and demonstrate them and capture the data that just isn't possible in the private sector. I think it's interesting that the VHA's mission is this. You know, this isn't my mission, you know, the words of mine, but I was so jazzed when I saw this. I'm like, wow, they actually have that as our mission, like to honor Americans' veterans by providing exceptional health care that improves their health and well-being. Now, I found that fascinating, right? Because there's nothing in healthcare that's actually designed to do this. So therein lies the opportunity. So, and it's true, right? You guys know this. So just two quick slides on context if you're not familiar with the VHA. In 2010, the Department of Veterans Affairs treated 6 million veterans, so it gives you a sense of who our patients are. And we have 1,624 points of care, 152 health systems, most of which are associated with academic affiliations. So we also educate more residents than any other system in the country. So all of this just to say the opportunity to have a large impact is very significant. So my office, we're standing up a new office called Healthcare, the Office of Patient-Centered Care and Cultural Transformation. So how's that for an undertaking? And I'm actually glad that the VA has claimed that as our goal, because I think anything short of that is less than what is needed. So the language I'm using, which I think you all can relate to, is to shift from what we currently have. And I'm not being critical. I'm not trying to be critical. I'm just trying to name what is in terms of what the current medical system, not just within the VA, but within the country, is designed to do, is to do good problem-based disease care. That's what our core competency is. That's what we're trained to do. Making gross generalizations, of course, there's pockets and people and places that have different emphasis and different strengths, but as a whole, this is what we're trained to do. And shifting from that paradigm to a paradigm that's patient-centered, not problem-based, and health-oriented, not only disease care. We need to do good problem-based disease care. It's not that that's wrong. It's just that it's insufficient if that's all that we're doing. And we have all the data to show that. The economics make that case alone. What we're currently doing is not working. I'm not going to go through all of this, but to define what our current as-is condition is contemporary, and what the will-be or transformed state is. I think I've referenced several of these. There's one or two I want to focus on a little bit more. We're going from focusing on disease to focusing on the person, and I'll say more about that, rather than being physician-directed, partnership-based disease management to health optimization. Instead of only finding and fixing problems, identifying risks and minimizing them. That obviously shifts from a reactive system to a proactive system, and from a sporadic interface with the healthcare system to lifelong planning. And I want to pause there and make a little bit more of a statement around that, because I think the planning piece is critical. A lot of what people spoke about today reference planning, but I also think if you ask me where are some of the trigger points where we could catalyze change in a pretty significant way, the concept of planning and the tools and the IT approaches to this are significant. And if you think about planning, it's fascinating to me to stop and think about, we plan for most things that matter to us in our life. You know, if you think about it, we plan for our education, our careers, our finances, our retirement, our kids, you know, and I do like to point out that in this country anyway, we, as a culture, we plan a lot more for our death than we ever plan for our health. You know, you think about it, right? You have a will, you think about what's going to happen to your stuff, your body, you're going to cremate it, bury it, you know, we give that thought, we write it down, we share it with our friends. We don't actually think about our health that way. We don't have a strategic plan for our health. So isn't it fascinating that something that's so important, we don't use that strategy for our health? And I think that's it's an organizing principle that can drive a different outcome with health. One thing that we learned in all of the ways we were modeling this, and I did not put all the research in this presentation because I knew that was being covered earlier, but when we went, oh, thank you so much. Is that bothersome to anybody? Okay, because I'm on East Coast time and I'm about to take a little nap up here. I really won't fall asleep at the podium, but thank you. I appreciate that. So one of the things we learned is, like, we modeled these things, we piloted these things, we created personalized health plans. They were lovely, they were holistic, they were individualized, da-da-da-da-da. And then we went, well, that's great. Well, you guys, now that you've had this wonderful experience in your personalized health plan, go on your way and let us know how that turns out. You know, and we kind of laughed later and went, why did we think that was going to work? Like, it takes a lot more to change behavior than a comprehensive personalized plan. So very quickly we went, well, that was really lovely, and how foolish are we that if people don't have the skills, as you've already heard, and they don't have the training, and they don't have the support, very little is going to change. Combining a personalized health plan with skill building and support, now that's a different idea. So these are some of the critical attributes of a transformed system. Some of us touch on this, but I'm the one, you know, my soulmate, by the way, that I just met today, Vic, he just left. I'm like, all right, I'm not going to take that personally. But this is why I got all excited about what he was saying, because one of the things we found out and our research has revealed is that, you know what, here's the thing, and I had this little aha moment of my own, which I'll share in a moment, where I finally realized the root cause of our problem in this healthcare crisis is that we are starting at the wrong place. We are not starting with the person. We are starting with their problem. Right? So, and if you need any evidence of that, just look at the medical record that I take down. When you come to see me, the first thing on my progress note is your CC. What does that mean? Chief complaint. So don't even come in if you don't have a problem. Right? If you came in to me and said, I'm here to optimize my health and well-being, I'd say, did you get lost? Like, what are you doing in the doctor's office? We don't know how to do that. The next thing after the chief complaint is the HPI, the history of present illness. Notice, I'm actually not that interested in your history. I'm only interested in the history of your illness. I want its symptoms, when it started, what makes it better, what makes it worse. And actually, if you could just sit quietly in the corner and I could dialogue directly with your illness, it would be so much more efficient, you know? I mean, I'm making fun of it, but it's true. It's the way it's... Then, after the history of present illness, we make a problem list. And we make a treatment plan for the problem, not for the person. Who the person is and what matters to them is not a part of the equation in the current medical paradigm. And then we wonder why people don't take their medicines and change their behaviors. Because I think your LDL should be at a number that maybe in 10 or 20 years you won't have a heart attack or stroke that you don't think you're going to get anyway, and I'm asking you to change the way you eat and live. What does that have to do with you? Why would that be? Why would we think that would work? But when we start with what matters to the person, what do you want your life for? What do you want your health for? In service of what? When you start from this point, rather than the problem, and you wrap the plan around this, everything changes. Everything changes. And we have the data to show it. I just didn't make this a data research talk. This kind of transformation requires both a change in the practice of healthcare and the experience of healthcare. And in my opinion, if we're going to hardwire this, technology and scale it, technology has a huge role in doing this. And we're seeing lots of great examples of that today. I'm just going to be a champion for we need to show one comprehensive model, or what we'll do is we'll still get a bunch of fragmented, siloed, interesting tools, but real transformation won't happen, in my opinion. So these are the steps in the ways that we're modeling this. And this is just, there's a lot of ways to do this, but as an illustration, starting before the clinical, the nice thing is this is not physician-centric. You know, what usually happens when you employ this kind of approach is clinical visits go down, hospitalizations go down. So, it's an efficient way to do it. But if you start with exploring with someone, what is their mission and vision? What do they want their health for? And that may sound really hoity-toity and, oh, you're on a spiritual path, but I got news for you. If you are a homeless veteran and what matters to you is shelter and food, that is an awfully good mission and vision. You know, this isn't just about the self-actualized, this is as real as it gets. What do you want your life for? What do you want your health for? And let us be in service of that. So if that is the context within which the patient comes in and has the clinical visit, everything's different. Everything changes. I was talking to a group of physicians in the VA, and this guy got up and he said, it was a real aha moment for him. And he said, I am stunned to realize that I have taken care of veterans, some of my veterans, for 20 years, and I have no idea what matters to them. And he was like shocked because he's a compassionate, caring physician. He said, I know all about their problems, their medical problems, but I have no idea what matters to them. And how different would their care be if in the next visit I put the list down and I just talked to them about who they are and what matters and how I could support that in their life. So after the clinician visit, a personalized health plan, I want to see the day that every veteran has a personalized health plan. And that is it's like basically a strategic plan for their health. We wouldn't run a business without a strategic plan. But, in the VA, there's over 100 different care plans. Because it's not the care plan for the person, it's like, I'm an OBGYN, it's like my part of your body, and my care plan for that part of your body, This is the veteran's personalized health plan. And it starts with their vision and mission, what matters to them, and it becomes a unifying force because all the fragments have to work within that larger frame. After the personalized health plan, teaching the skills to achieve it. And the emphasis on mindfulness, some of my questions is another talk, but it's an important piece of the pie, in my opinion. Not only do you need the skills, but the support and the behavior change that works. And, we've heard coaching a lot today, which I'm excited about because I think that's an effective strategy. And I would say, much like my best buddy Vic said about not customizing, that wasn't his word, but what was his word? Tailoring, right. He said there's tailoring and then there's deep tailoring, and I'd say the same. There's coaching, like everybody's using that word, and we got to figure out, well, are we all saying the same thing? I'd say there's coaching and then there's deep coaching. This kind of coaching are coaches who are trained in this process. So they start with your vision and mission in life and go from there. And then the clinical follow-up. So this is just, only study I even referenced in here is this first proof of concept, which was funded by Medicare, Medicaid, because it was my aha moment, so I just wanted to share it briefly. It was a randomized controlled trial. It was a 10-month intervention, people at risk for heart attack and stroke. And just to give you a sense of it, across the 10 months, there were 2 20-minute touches from the physicians. So this was not an expensive trial. It started with a health risk assessment, my good buddy Vic, but it was a traditional health risk assessment, but we used it as a way to get people's attention. Aside from that, it wasn't particularly helpful, but it was a wake-up call, a kind of virtual wake-up call for some people. The personalized health plan was formed. Then they had 10-month intervention with experiential education, so not just someone talking at them, but learning the skills in different domains of health, and 10 months of in-person personalized health plan coaching. These are the domains, this is when I was still at Duke, these are the domains of the health plan that we used at that point in time. And I just put them up here to reinforce, as you all have been hearing throughout the day, most of this is self-care. When it comes, that's one of the problems with our healthcare crisis, is most of it comes down to the self-care, and yet the medical system is only focused on the, what can we do to you? That's the visual for the wheel of health at Duke, puts you in the middle, and I wanted you to notice that we have mindful awareness around the center of that, because if people don't have the skill of being present and noticing their state of stress, their state of hunger, et cetera, they're not going to be able to be proactive in their decisions. So the outcome of that study was exciting because we reduced what we wanted to reduce. We found a significant reduction in risk factors for heart attack and stroke, and that's hard to do in a healthy population, but we were excited. But the big message for us was the second point, which is, I gathered everybody together because it was a multidimensional study, and I wanted to really understand what happened in that trial. I can't read that sign.
To wrap up, 3 minutes.
3 minutes. Okay, so in conclusion, I'm going to skip through that. Just to give you a sense of the future and the reason the tools are important is, if in medical school I was told I had to fill out this form and ask these questions, I would have been doing it, right? So there's a lot of power in standardizing these approaches. The tools are critical, and if I was told these are the things I need to do instead of the things on the left, a lot would change. So when we put the patient at the center, truly at the center, like really, truly at the center, then everything else shifts. Then you get the change in cost, the quality, and the improved experience. I like to emphasize, because I think there's a risk, at least in the medical world, of us making a better box, like decorating the box really pretty and feeling good that we did good things. And we can do a lot to make our current medical system better and the delivery system better, and we can tell our physicians and everyone, be more empathetic. It's not enough. That will not shift the system that we've got. So we've got to do more than that. And I want to close, my last 2 slides, or 3 maybe, are just to make the point that I think with veterans we have a very, very unique opportunity to do this. If you think about the culture of the military, everyone in the military knows the importance of mission. They are serving this country's mission. They understand the importance of a plan. They would not be going to battle without a plan. They understand the importance of skill building. They would not be going to war if they didn't have training first in the skills they needed to accomplish the mission. It's like, duh, right? And what about trust and reliance on each other? There's no community I know that understands more completely the reliance of each other, their fellow airmen, soldiers, sailors, and Marines. Absolutely critical to these men and women. So this is interesting to me that these are the very same values that we're building on in this approach to healthcare. A mission for their life and health, a personalized health plan, training and skill building, and team trust and support to succeed. The VA of the past, what can I fix? It's physician-centric, paper medical record. Thanks for driving 5 hours to get here. Come back if you don't feel better. VA of the current system, we have a clinical team. The question's more like, how can we help what's wrong with you? So still a focus on what's wrong with you. We do have a great electronic medical record that led the field 10 years ago. Still disease-based, however. You have a medical problem, please follow this treatment plan to improve by your next visit. And the VA of the future, how can we help you live your life fully? That's the question I want us to be. I want veterans to come to us, and I would love to see the day when Americans use their healthcare system to help them live their life fully. And the healthcare system isn't the medical piece. It's all that we've been talking about today. The veteran, the family, the community, the healthcare team. We have a personalized health plan and a whole person medical record, and we design your personalized health plan to help you reach your goals. In conclusion, veterans committed their lives, their health, and their well-being to the mission success and defense of this country. And now we can help them be mission ready for their lives. I love that, I have to tell you. I love the thought of let us help you be mission ready for your life, optimizing their health and well-being in service of what matters to them. And when that's successful, veterans will achieve outcomes that they never even knew were possible. To me, this is the future of healthcare for our veterans and for the rest of our country. And I'm very, very honored to be working in the VA and to hopefully be helping to model this nationally and working in concert with you all. So thank you very much.